Medical marijuana might be a great addition for management of your chronic back pain. Chronic back pain is most often experienced in the lumbosacral area, which starts here, basically at your waist or a little above your waist, down to here, the sacrum, the lumbosacral area. The lumbar spine is the part that curves in, which is what we refer to as kyphosis. And the sacrum is that little triangle in the bottom that sort of fits into your pelvic bone. Now, if you have been denied the opportunity to proceed to lumbosacral back surgery for stabilization or improvement of pain, feel relieved that that was the outcome for you. Because even after all these years, these surgeons are just practicing on your back. The rate of failed back surgeries with subsequent syndromes of pain and limitations to function is almost 70%. 7 out of 10 people do not get relief long-term from their back surgeries. And when this fails, it's not just a matter of going back to surgery. There's loads of scar tissue there, and you can get all kinds of problems with doing the second surgery, much more complicated than the first. So you really have to focus on all of the other things that are required to create a healthy, strong back. That includes plenty of yoga for stretching and flexibility, preferably twice a day. You don't have to do it in a man bun if you don't want to. And quitting smoking is critical, not only for the reduction in cancer risk and heart disease risk, but also because smoking dehydrates the intervertebral discs. They show up as the clear space between all of these bones, and they're responsible for giving you a little bounce, a little squish in your step, so that when you go down steps or if you step off a curb, your back has got that little extra resilience and is going to tolerate all the bouncing without any problems. You might notice over the course of the day that from the morning till the evening, you actually have to adjust the rear view mirror in your car down a little bit because you lose about a half an inch a day from these discs getting sort of pounded down. Now, if they don't rehydrate and replenish with fluid overnight during your sleep, and then you go out and, stumble a little bit, your back's at much higher risk of re-injury. So the smoking is very difficult to stop, but that's gotta happen. Back pain arises from a combination of osteoarthritis and muscle spasms, as well as some nerve impingement, nerve-based pain. And we know that cannabis is great for muscle spasms. We know that not only for back pain, but of course also for multiple sclerosis and similar muscle conditions. And of course, we don't have enough data to recommend grass for management of back pain. Further studies are indicated. But I'll shoot a strain recommendation video next that'll help you make the perfect choice.